So now we're going to test for hip extension. For hip extension, you want to make sure that the patient is prone and their pelvis is in neutral with the knees being extended, and you want to make sure that the hip is in 0 degrees of abduction, adduction, and rotation. To make sure that the pelvis is in neutral, we want to palpate the ASIS and the PSIS and make sure that they are vertically in line with one another. And Katie is good. And then to test for 0 degrees of rotation, we want to palpate for the medial and lateral epicondyles of the femur and make sure that the patella is facing anterior. Okay, so she is also good there. For this test position, you can also place a pillow under the patient's stomach in order to help with comfort, but if you do that, you want to make sure that there's no hip and lumbar flexion. So we want to stabilize the ipsilateral pelvis by placing our hand on the ASIS and the PSIS to prevent it from anteriorly tilting. And we want to also make sure that the contralateral lower limb is flat on the table. So for the testing motion, we want to stabilize the ipsilateral pelvis, and we want to keep the knees extended, and we want to lift and extend the hip. So right about there, the end feel is going to be firm, and you're going to start to feel the pelvis anteriorly tilting. So we're going to place the fulcrum at the greater trochanter, the proximal arm lateral to the pelvis, and then we're going to place the distal arm lateral to the midline of the femur. So I got 14 degrees, which is a little bit lower than normal, but still good. Test position for hip extension. So the patient is going to be side-lying, and we're going to have her leg being tested on the top, and then we're going to have the other leg just slightly flexed underneath it. And we're going to make sure that her spine is in neutral. So she's good. And then we're also going to make sure that the hip is slightly flexed and the knee is also slightly flexed. So we want to stabilize the pelvis by palpating the ASIS and the PSIS. So here. And then we're going to take the leg and we're going to extend the hip. So right about there, the end feel is going to be firm, and then you're also going to feel the pelvis anteriorly tilting into your hand. So we're going to take the goni and we're going to place the fulcrum at the greater trochanter, the proximal arm on the lateral side of the pelvis, and then the distal arm is going to be on the anterior midline of the femur, and we're going to use the lateral epicondyle as the reference. So I have 17 degrees. No, 15 degrees. So 15 degrees, so Katie is a little bit below normal, but she's still okay.